And I've just, again, been honored and humbled to be able to mentor and precept and just walk along the halls. We worked hand in hand at the bedside, just taking care of some of the sickest of the sick and just creating miracles every day. I just try and truly just live by the values and just have joy and fun at work too, which sometimes is kind of hard when you're taking care of really sick people, but just trying to be compassionate and making every experience just as good as it can be. You never know what impact you have on people's lives. So when you get to see those little nuggets, those are really kind of the special ones to me.
What always has motivated me was supporting, my friends and really my family. And it encouraged me every day to get to work and to be here and be accountable, so we could care for these patients. We were a COVID ICU, and it was just saving those people that you didn't think were going to make it. And they did, and it was truly rewarding to work so hard and to actually see them get better and go back home to their families. And that was great.
I always knew that we were like family. I always knew that, we got along well, we loved each other. But not only was I going through stuff with my family, having my family here, some of the other staff members had their family here at the same time too. So it was like, just brought us even closer together. And they always pick on me because I always say, I'm here to do a job, I don't have any friends at work. And during that time, it just became, okay, I'm gonna stop saying that. Y'all are my friends, I love y'all. It just made me realize that I have to stay here, and I have to continue doing the work.
This hospital, this culture that we have here works. It's a great culture. All the way up to administration with support for all, not just nurses, for all the employees here. It's just a great team that works well together. Everybody's very transparent. Everybody is patient focused, and I really like this environment that we're in over here. It's great. They're all here for one thing, and that's to take care of patients. And I always try to instill in every nurse that I ever see, if you're keeping the patient at the center of everything that you do, I will always back you up. As long as they are at the center, then you can't go wrong, because that's what we're here for. We're here to take care of patients.
Wanting to serve. I still run into this hospital every day and still have that passion and that burning desire to serve. Anything personal, I leave at the door, and when I walk in, it's seeing the people in the hall and trying to get them where they need to go. But I love coming to work every day.
So I started at the AMC campus in 1995 as a part-time employee while I was in school, and then during my last year of school, and then when I finished school, I worked there full-time from that point, whether it was LSU Medical Center or LSU Health Science Center or University Health, and now Ochsner LSU. I was with them throughout all those transitions. Well, I'd say you don't have to wait 28 years to make an impact. Everybody who rushes into a patient's room, everybody who interacts with a patient visitor and the staff member can make an impact that day. And so that's what I share to people, is like, you never know what your impact actually is until you make it.
We want to take a moment to recognize some of the legends that make our campuses exceptional.
From our dedicated physicians and nurses to our hardworking support staff, we have some real legends amongst us.
Our hospital wouldn't be the same without you. You provide exceptional care to our patients and live out our mission and values.
As I think about the mission statement, I just encourage all of you to embrace your why through the mission statement, either to heal, lead, serve, educate, innovate, and in the context of this organization, to discover. Thank you. I'm looking forward to working with all of you, and game on. Let's have some fun.